Dr. Tushar Patel, welcome again to ITV Gold. Thank you so much for giving us your time today.
Thank you so much for getting me back again.
You know, we have you back because there is so much news that's coming in today regarding COVID-19 and its updates, so let's go right into it. My first question to you, a big news that came from World Health Organization. Today, the World Health Organization has urged fully vaccinated people to continue wearing masks indoors and practice social distancing as the Delta variant surges in parts of the world. They have made their guidance split from the CDC, who has now allowed everyone to be indoors that's fully vaccinated without a mask. How are you looking at this? Why did WHO go against the CDC guidelines?
So the WHO is looking at the long-run data from this pandemic, what we learned from last year. Delta variant is definitely a concern, area of concern. It's a dominant strain, estimated 10% of cases in the USA, and responsible for about 20% new infections in the country. 1 in 5 infection is from Delta variant. The good news is a lot of people already vaccinated. However, there are so many people in this country, more than 50% are still not vaccinated. So
Right.
that is the whole reason WHO is giving this guidance to be careful and take precautionary measures now, so we don't end up in getting the second or third wave in this country like before.
They're also saying that the spread of coronavirus is now outpacing vaccinations. Again, this is a global perspective they have had, but some of that is actually happening here in the United States as well. We have states with low vaccination rates. How are you looking at that, and how does this Delta variant truly affect people that are fully vaccinated?
So as you know, only 46% people in this country are fully vaccinated. There are 5 states less than 35% vaccination rate: Alabama, Arkansas, Louisiana, Mississippi, and Wyoming. So the southern and western states are not doing so well, and we have free movement in this country. That definitely can lead to a new surge of infections in this country when the fall and winter comes. So that is the whole reason we all need to be vaccinated as quickly as possible.
So let's talk about a little bit more about these states, Dr. Patel. I have a question where I would like to know, how are these states that are vaccinated, such as fully 70% vaccinated with at least 1 dose, such as New York, New Jersey, Connecticut, how will they get affected if the other states that have low vaccination rate continue to do so?
Definitely that could impact our progress as well in this part of the country, and that is the whole reason we have to be careful now, because those 5 states can bring the infections to our states here in this part of the country, and definitely we can have a next surge because our younger population are not fully vaccinated yet. Many of our population in this state also not fully vaccinated yet. So that is definitely can impact the overall progress of this pandemic in this country.
According to John Hopkins, doctor, 23 states had more cases in the latest week than the week before, and 26 states had more deaths than a week earlier. My question to you, I think I've asked you this before, have we reopened too fast?
I think after the fully vaccinated people, some states like Northeast states, New York, New Jersey, Connecticut, they open up the way it's supposed to be. However, it's too early to say that we opened up too quickly. One stats I want to give is yesterday only we had 15,000 new cases in this country. So we are not off the hook yet. We still have concerns, and I think states should take all the measures they can to reduce the spread when the fall and the winter month comes.
You know, this is summer, people are going out. My question to you is, how should they be behaving outside when they are outdoors? You know, recently, pride parades across the country gathered thousands of people together, hopefully all vaccinated, but they were maskless. Should this be happening right now?
No, so my message right now is for the outdoor activities, if you are 100% sure, if they check the IDs for the people who got vaccinated, they can be maskless. Other gatherings, indoor or outdoor, regardless of the mask, they should have the mask available for them and wearing the mask, because it is very tricky situation for the outdoor and indoor setting. So it's very important then we protect ourselves by wearing the mask.
Right. Again, the mask has always been a topic of discussion. 4th of July weekend is coming up, Doctor. White House is going to have a celebration. I'm sure most of them or all of them will be vaccinated. But how should the rest of the public celebrate this? Because usually it's parades, flocking to the beach, large gatherings. Again, what's your advice?
Large gatherings with the close proximity of people whom you don't know if they are vaccinated or not, you should wear the mask. That is the only way you can get the protection, especially the young individuals who did not even get one vaccine dose. That is my message to the viewers, that they should get the vaccination as quickly as possible, because even the outdoor setting with the close proximity, you can spread the virus, and definitely you can spread the pandemic more.
Let's talk about the vaccines a little bit, Doctor. Pfizer has said that it is 88% effective against the Delta variant. Moderna has come out and has said that its vaccine is effective against most and all variants. Now, I'm looking at this 88% effectiveness. Is that something that you worry about?
Yes, I definitely worry about that, because the problem with the Delta variant is 50% more contagious than the Alpha variant, and is responsible for causing more severe illness and hospitalization. So even if you are fully vaccinated, and if you come into contact with someone with Delta variant, you may spread the virus.
Oh, wow, that is a thing of concern here. When we're looking at Moderna, Moderna also has come out and said that its immunity can last longer. The vaccine immunity can last longer than perhaps a year. Right now, there's a lot of conversation happening about the booster shots for the vaccine. My question to you is, why do we need these booster shots, and when do you predict we'll be needing them?
I think my prediction is about 6 to 9 months protection at the most. I do not believe this protection will last longer, because we have these variants coming up, and the virus mutates just like flu virus every year. So I think the one season is gone. So the next season comes this fall. We may need the vaccination this year or early next year.
Oh, wow. I have this new results that have come out, in which people who have received the mRNA vaccines may not need boosters as long as the variants do not drastically evolve. Your comments?
That is yet to be determined. It's too early to say. As we know, the virus is more than a year, 15 months old. We don't know how it will progress, how it will mutate in 2022. So at this point, my educated guess, medical guess, is we may need a booster shot within next 6 to 9 months.
Oh, wow, that's coming very soon. I'd like to discuss something more with you on vaccines. I have this data which says 95 of those who have died from COVID-19 in Wisconsin since March were not vaccinated or fully vaccinated. Nearly all people in Wisconsin who have recently died of COVID-19 were unvaccinated. Are you seeing this pattern all across the country in hospitals?
Absolutely, absolutely, and that is the huge message for the viewers, that if you don't protect yourself by getting the vaccination, your chances of getting the infection is as good as last year 2020. So the best way we can protect ourselves is to get the vaccine now.
Are you afraid, or do you have any fear of having a massive surge in the fall? I know we have discussed the fact that the surge will not be like last year in the fall because of the vaccinations efforts that have been across the country, but how big can this surge get?
So we only at 46% of fully vaccinated population. So
Right.
more than half of our population is not fully vaccinated. If we go this route, if we go this space until end of summer, we're definitely gonna see a huge surge. Not like last year, because 50% of the population is vaccinated, but we still can get another surge, which can be concerning for this country.
Let's now talk about vaccines in children, Doctor. We've had a conversation on that before as well. How important is it for them to be vaccinated? And also, are you seeing a lower vaccination rate amongst this age group?
So the young individual still believes that they are foolproof. They will not get this virus. Since the adults are getting the vaccine, they don't need to get the vaccination for themselves. That is the wrong message. I think that misconception has to be cleared. everyone who are eligible to get the vaccine should get the vaccine as quickly as possible, especially the schools. Some of the states, the schools will open in middle of August. You are at that window now. We have the golden opportunity to get as many people, the young individuals, vaccinated as we can to reduce the spread when the school opens up in fall.
What are your comments on the issues of heart inflammation that we are seeing amongst young adults? That is also preventing parents, especially the ones that have 12-year-old, 13-year-old, from getting that because they do not know what the side effect would be.
The vaccine so far, the benefits outweighs the risk. It's minimal side effects for the young individuals. There are some infections, myocarditis, inflammation of the heart muscles that came up recently, but those are not that common, very uncommon, very rare side effect. And I think that the study shows that it could happen even without the vaccination in those young individuals. So I would not worry about the side effects for the young individuals. They should take the vaccine, whatever vaccines they have available right now. And I think that is the only way we can protect our population.
So let's look at it. 12 and above can be vaccinated. So we're looking at middle school students and high school students. What I have as information is 2 to 11 years old may have the vaccine by end of fall or beginning, like end of September or beginning of October. And then hopefully 6 months to 2 years old will have this available, the vaccine available for them late November. That's the information we're getting. My question to you is, how should schools be handled? Pretty much every state right now is about to go in person without a remote option for students in the fall. Is it wise? What should be followed? And how should this be divided?
So I think we need to start using the common sense approach, because the virus has the etiology, virus has the pathogenesis. If you don't follow the virus trend, I think you will definitely get into trouble. So by opening the schools without any kind of protection or requiring the students to get the vaccination, it can lead to a disaster for the school year coming up in September. My strong recommendation is there should be some kind of guideline need to come from CDC, which will allow hybrid school or some kind of requirement for the vaccination proof for the kids.
Yes, that's definitely a really good point. Another news that has come out, Doctor, recently about the vaccines is, even though the vaccines are highly effective and they protect people, roughly about 10 million Americans whose immune systems are compromised because of medication or disease may not be well protected. What are your comments on this?
That is the huge concern, and we have been talking this almost all the time, that those people who are not eligible to get the vaccine, they should protect themselves by either staying home, wear the mask in public, and protect themselves by allowing to screen their symptoms quicker, so they can reduce the spread of the virus themselves and also to the others.
How are you looking at high-risk patients or people with compromised immune systems, such as diabetes or lung disease? When they get their vaccine, are they more protected than these 10 million Americans that we're talking about?
Absolutely, because the people with diabetes or hypertension or cardiac disease or asthma, if they get the vaccine, their chances of getting the infection is very minimal, and they are very much protected from fully vaccinated rate. So I would strongly recommend for those individuals who are has comorbid conditions should take the vaccine as quickly as possible, and hopefully most of them already took the vaccine. But if they have not taken the vaccine, this is the time to take the vaccine before we start into the fall and winter months.
Another thing that's come up, doctor, is the fact that pregnant women are more at risk for COVID than getting, side effects from the COVID-19 vaccine. There has been a whole campaign to raise more awareness about pregnant women getting vaccine. How are you looking at that?
I think pregnant women should get the vaccine even in their first trimester, or even in second or third trimester. There is no contraindication for the pregnant female not to get the vaccine, because I think that will protect themselves as well as their newborn coming up. So I think it's very important for the pregnant female to follow, unless they fall into some other kind of medical condition which precludes them from taking the vaccine.
And how are you looking at therapeutic treatments of COVID-19? Has there been any advances in it, in medication or treatment?
So there are a lot of research going on with the oral medication, just like Tamiflu for the influenza. We haven't come up with strong evidence-based therapeutic levels for this COVID-19 treatment. So I think we are still in the works for that. Hopefully within next 4 to 6 months, early 2022, we may see that, and I think that will be a game changer for COVID-19 management in the world.
So will that affect people with mild symptoms, or are they also looking at people with severe symptoms?
So what happens with this antiviral treatment, the one we use for influenza right now, Tamiflu, that definitely reduce the overall length of the illness. That's number one. And number two, the severity of the illness is also goes down. So let's say someone got positive COVID-19 today, and if they get this oral antiviral treatment within 48 hours, their chances of getting the hospitalization will be reduced, the death rate will be reduced, and the complications of pneumonia will also be reduced by that medication.
Right. Let's now talk about India, doctor, our motherland to many of our viewers. How are you looking at the current numbers of cases and deaths in India? And I ask you because there is a lot of conversation about the fact that those numbers are a huge undercount. So now India is saying that the cases are declining. However, are they really declining? What is exactly happening in India?
So the reporting system in India, unfortunately, is not that great, and we have talked about this in the past as well. That the current public health system in India, the infrastructure of healthcare system in India, is not that great. The mortality rate is not always reported. The new cases are not reported. It has the way it's supposed to be reporting to the public health officials. I think those are the concerns. The numbers coming there are not trustworthy, and especially in the rural areas where there is no infrastructure of healthcare system, there are no hospitals. So I think it's a mixed message right now. Hope things are getting better there, but I'm not that optimistic that comes winter months, they may see some kind of surge in India as well.
So let me ask you, doctor, do you think India is out of danger right now? Because there are so many reopenings happening across India in big cities such as Delhi and Mumbai as well, which were severely impacted by COVID-19. What do you say?
Absolutely not. They are not off the hook yet. I think the virus is still there in India, and very well that could be another wave when the temperature goes down in the winter months. And I think the problem with India is 1.4 billion people. The control is always a challenge, but I think all people should understand that they have some responsibility to do the right thing for their country, for the neighbor, for the community. And if they cannot do that, they will definitely suffer in upcoming months.
When do you expect 70% of India to be vaccinated?
My educated guess is 2022-23.
Oh wow!
Not before then. End of 22, because right now people are saying that 25% of population got vaccinated. I hardly believe that. In my opinion, about 10% of the people got vaccinated in India.
Oh wow! How are you looking at the Delta Plus variant affecting India, and do you think that would also spread across the country and be of more danger?
Delta variant is a huge concern for the entire world, especially India and the UK and the USA. And if we have to ensure that we take all the appropriate precautions and necessary steps to mitigate the Delta variant coming in this country. And it's a huge concern for India because the population it's unbelievable there.
Doctor, I wanted to also know about Delta Plus variant, the new one that we keep on hearing coming from India.
That is also going to be a concern because it's same kind of pathogenesis has very more contagious, very effectively infecting other individuals, and twice likely for hospitalization and deaths. So I think definitely it's going to be a concern, and I think we all should take all the precautions we can right now to mitigate that Delta Plus variant as well.
Indian health officials are saying that the country should brace for a third wave by October. That's just in a couple of months. Your comments?
I think I hope that is not true. But the way things are going, things are opening in India right now. The low vaccination rate. I think it can happen. Let's hope not. But I'm pretty sure that the virus will take its course, and if we don't mitigate that course, we'll definitely see those surges as well in India.
What can the Indian government do right now, doctor, to prevent this surge that could come in October? What should their steps be?
Take some precautions right now. Let people know the virus is still there. That's number one. And get as many people vaccinated as possible, especially the older individuals, 65 and above. And I think they need to reach out to the rural areas.
Right.
There are so many misbeliefs in so many communities, and the racial areas in India, and I think those needs to be addressed as quickly as possible. And government needs to give a clear message that right now the infection rate is low, but we can go to the third wave very quickly if we don't follow the protocols right now.
And my last question to you, Dr. Patel, I would love to know your predictions for both India first and then the United States for the next couple of weeks. What can we look forward to? What should we protect ourselves from?
So my prediction for India is people need to start taking the vaccination as quickly as possible. Don't do the usual stuff they used to do pre-COVID era. Even the government is not telling. I think those are the message I want to give. We want to make sure that all people who are eligible get the vaccine as quickly as possible. And I think some common sense approach that we cannot be doing those thousands and thousands of people indoor events, the weddings and the gatherings in India for next few months until we reach that threshold of the vaccinating about 60-70% people. For the United States, we need to get the vaccines into the hands of primary care physicians or the doctors in the community, so people can trust those people who already are convinced they already got the vaccine.
Right.
Now the next challenge comes to for those people who don't trust the vaccine, who has the misinformation. If the vaccination is given to the hands of their primary care physicians or doctors in the community which they trust, I think it would be easier for them to get the access. And I think those are the major thing. One thing I want to say, more than 19 million in total cash prizes were offered as incentives already in this country. So I don't know what else government can do here. I think that build up the healthcare resources in the vulnerable communities, the minority communities, the Asians, the Mexicans, and the African Americans. I think those are the biggest challenges we have right now in this country. And if we do it this is the golden time. Next 2 months is the golden time because the spread is low. If we can ramp up the vaccination rate in this country, even 10-15%, I think we will not see a next surge coming in fall and winter months.
Oh, I hope whatever you said is true, especially about not having a surge in the fall. Vaccines.gov is the website for everyone. You can go and find information about the nearest location to you to go get the COVID-19 vaccine. Dr. Tushar Patel, thank you so much for your time today.